Hey guys, this is Dr. Carter from Shasta Community Health Center. I just want to take a few moments of your time and just explain some things that we're doing here at Shasta Community to help you. And I also wanted to explain some things that I think some parents haven't thought about keeping our kids safe during this COVID-19 pandemic. I know a lot of people think, hey, yeah, I know Dr. Carter, wash your hands, stay away from people, that kind of stuff. But there's actually something that a lot of people haven't thought about, and that's keeping up to date with your child's immunizations and their well checkups. And this especially applies to kids under 6 years of age. Our concern is that there are vaccine preventable illnesses that if a child gets them, that will suppress their immune system, and then they can get actually sicker from COVID-19. So we obviously want to prevent that. We here at Shasta Community are doing some pretty impressive things to help make sure that your child and your family are safe. For one thing, we actually have what's called a triage system. Now, I know people have heard that word, and it basically means a screening. It's a screening at the very front of the building where anyone that's at risk or seems to be at risk for having COVID, it actually goes to an entirely different building. So they do not come into the Pediatrics Department. The other thing that we're doing is that our lobbies and waiting rooms are set up so that there's spacing that's supposed to be so we can have our safety distancing and practice that. The thing is, though, you probably won't even have to use that because our front office staff is doing an amazing job at being able to check people in and immediately room them. And when you come to our rooms have been thoroughly cleaned. We have a staff that does an amazing job of wiping everything down. The other things that we're doing is we're actually setting specific times for well checkups. And we're actually going to try to keep those times in the morning from 8 to 11. Now, there's a couple of reasons behind that, but the biggest thing that we want to do is to make sure that every child that's out there is a well child. And you can rest assured that that's what it will be. From that time period, that's all that will be here will be well child visits. I know that several of you may still have some other questions, or you may have some things that you're like, I'm still not sure I should bring my child in for. We have a nurse answering line here that are willing to answer questions. We're even doing physician phone visits, so that's here to help you out as well. Thank you for allowing us to take care of your children, and I do appreciate your time, and I wish you all the health and happiness possible.